The Minnesota Nurses Association held a press conference first thing today after its members voted late last night. They say an overwhelming majority voted in favor of an unfair labor practices strike. How long it would last depends on the area.
We are announcing today our intent to strike at 17 hospitals throughout the state.
The Minnesota Nurses Association says the strike would start 7 a.m. on December 11th. 3 months after it held a 3-day strike involving around 15,000 nurses statewide. But this would last longer.
While nurses at St. Luke's in Duluth and at Lakeview in Two Harbors have chosen to strike with no end date in sight.
Twin Cities and Essentia Health nurses plan to finish New Year's Eve morning, a total 3 weeks off the job.
We don't want to be out on that sidewalk, but the conditions our executives have created in our hospitals are unsustainable for our nurses, but most importantly, for our patients.
We are the nurses.
Union leaders say contract talks have lasted nearly 9 months now, and hospital staffing levels remain a sticking point.
The hospital is at capacity and is maxed out. Sometimes families are waiting for hours and days to be admitted to a room.
Just imagine a patient sitting, in poop, putting on her call light or his call light, and you can't get to that patient for over 30 minutes an hour.
They say talks were held as recently as this week with some hospitals.
Mainly we are asking for good staffing, to have a say in the grid.
At the negotiation table, their answers remain unchanged. They do not want nurses involved in the decision-making process.
Staffing needs to be addressed, and without that, we are nowhere close to getting that tentative agreement to avoid that strike.
MNA leaders said bringing in a mediator only helps when parties are close to reaching a deal. When asked what progress has been made, they said it depends on the hospital, but that with Allina Health, they have agreed on some workplace violence protocols. Also, back in September, you might remember nurses were asking for more than 30% raises over 3 years. They now ask for about 20%, but some hospitals are offering 13 to 14%.
All right, thank you, Kaya.